Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Minister of State for Budget and National Planning denies a report that the federal government received $5.6 billion donation for COVID-19. India records highest single-day number of deaths globally. Oxygen beds still in short supply. The Nigeria Center for Disease Control has reported a system failure by one of the partner organizations supporting the management of the COVID-19 travel portal on the 20th of April, which led to an unforeseen downtime. In a tweet by the agency, it says the technical failure was resolved following about 12 hours of inactive time. The NCDC says they accept full responsibility for the event, which led to inconvenience for several travelers to Nigeria. However, the center reassures Nigerians that they'll continue to strengthen the process to make it seamless for travelers. Now, let's take a look at some of the virus trends in Nigeria and the rest of Africa.
According to the Africa Center for Disease Control, the continent has reported over 4.4 million cases of COVID-19, about 3.1% of the global numbers. While the death toll is stable at 2.7%, the trend in the past 4 weeks shows new cases observed in most populous countries like Egypt, which is recording 7%, Ethiopia about 3%, and 1% in South Africa. Other countries seeing a decrease in cases include the DRC with 1%, 5% decrease in cases in Kenya, coming through a third wave, and Nigeria at 19%. The Nigeria Center for Disease Control, NCDC, has registered 65 new infections, a drop from the 120 single-day count recorded in the previous 24-hour cycle. The agency says the new cases were reported from 11 states, as Lagos leads with 41 cases, followed by Kaduna with 6. Kano, Rivers, and Plateau states reported 3 cases each. Akwa Ibom, Imo, and Oyo had a record of an additional 2 cases, while Edo, Bauchi, and Osun confirmed 1 case each. The latest tally has raised the total number of confirmed cases to 164,488. 35 persons have been discharged in the last 24 hours after testing negative to the virus, raising the total number of discharged persons to 154,441. 56.3% of the country's target population have now received the Oxford AstraZeneca vaccine. That's according to an update by the National Primary Healthcare Development Agency as at 21st of April, with states like Lagos, Kano, and Kaduna leading the chart with the number of the target population reached. So far, 1.2 million doses of the COVID-19 vaccine have been administered and over 2 million doses outstanding. In the meantime, vaccine rollout on the African continent stands at over 32 million, with 15 million doses administered, representing 0.8% of the population.
The Minister of State for Budget and National Planning, Mr. Clement Agbra, has been reacting to some claims in some quarters that the federal government has received over $5.6 billion as donations to address the challenge of coronavirus in the country. Speaking to reporters after a meeting of the Open Government Partnership in Abuja, he condemns the report, describing it as false and misleading. According to him, he explains that government's intervention in tackling the pandemic, which resulted in low oil and non-oil receipts, is yielding investments in the nation's health sector.
Let me also use this opportunity to speak through to some of the things I saw on Twitter yesterday, where one of the civil society organizations to whom I want to go and address now are saying that the country received a donation of $5.6 billion. That is incorrect. Nigeria did not receive a donation of $5.6 billion to take care of COVID. What indeed happened is that as a result of the shortfall in revenue due to COVID-19, where there were supply disruptions, the demand for oil also fell. It led to a reduction in the price of crude the world over. And because of this demand issue, OPEC and OPEC Plus had to reduce production of the various member countries. And Nigeria was not left out. We have a capacity of producing about 2.5 million barrels a day, but we were restricted to 1.4 billion barrels. And you know what that means. It seriously affected our revenues. And the price came as low as $12 in April last year. So we needed to look for funds to ensure that we augment the budget in order to ensure that we meet up with stimulating the economy. So it's not correct that Nigeria had a donation of 5.6 billion.
Let's now go over to Bayelsa State, where the Director of Public Health at the Ministry of Health has disclosed that even though most residents of the state are usually seen without their face masks in public spaces, the number of persons testing positive for the virus has reduced drastically. He says the ministry is still actively testing for COVID-19.
This sight of traders and buyers moving freely without the use of face masks and not maintaining any form of social distance is prevalent in all the markets and public places in Yenagoa, the Bayelsa State metropolis. The use of face masks is now a rare sight, except at government and private sector sponsored events such as these, where the use of face masks and hand sanitizers is compulsory before entry.
It worry me when I wear them. Never agree me to talk. Now I know wear them, I get them.
If you wear the mask, they feel comfortable. Understand? Like for me, if I wear the mask, they feel breathe well. They take me uncomfortable. So before you know, I don't shift them from mouth to to this place like this.
Whilst community testing for COVID-19 is ongoing, the state is also getting ready to embark on its second round of COVID-19 vaccinations.
We've gone through the first phase. We've vaccinated over 13,000 persons. We're about going to their second doses now to give them their second doses, and that process is going to start very soon. The process has been successful, and we're happy with the acceptance of vaccination by Bayelsans.
The Chief Medical Director of the Niger Delta Teaching University restates the fact that COVID-19 virus could still be contracted, so people should deliberately imbibe healthy habits and abide by the NCDC safety protocols.
COVID-19 has not gone, it's still with us, and we ought to be very cautious. We ought to continue to observe all the protocols, especially non-pharmaceutical protocols, and which includes wearing of face masks, ensure that you practice hand hygiene. Avoid using your hands if they are not washed, or if you have not used a hand sanitizer, to touch your eyes, your nose, and your mouth. And as much as possible, avoid crowded places, but if you are in a crowded place, ensure you use a face mask.
42,000 doses of the COVID-19 vaccine were given to the Bayelsa state government, and so far, 13,000 persons have already gotten their first shot of the vaccine.
For more on the MPIs and compliance, joining us via Zoom is Dr. Samuel Okarinde, a public health physician. Thank you for joining us on the program.
Thank you for having me.
Nigeria seems to be weathering the pandemic better than some countries, and according to the Africa CDC, we're reporting 19% decrease in cases. However, could it be that there are infections unaccounted for in asymptomatic cases?
Okay, thank you very much, Millicent. Yes, there have been some decrease, but we really can't say that that is absolute. Because if you look at the number of people that have been tested in Nigeria, we've tested just barely about 1.8 million people, less than 2 million, and in a population of about 200 million. So when it comes to testing, we actually haven't done well in that area. Okay, then of the less than 2 million that we've tested, we've had about 164,000 cases. So it means that if we had tested more cases, most likely we would have been able to pick up more cases. But that aside, also because the COVID-19, we've had more of the mild case. So people who have such symptoms, we just probably feel they have malaria, maybe with some drugs, and they are fine. So we can't say that for sure we have been doing well in testing, because even that currently now, a lot of people really don't just test. Okay, but by and large, we'll say that we haven't really done badly in terms of COVID-19, basically.
Could we in any way attribute it to the number of vaccinations that we have recorded across the country, impacting reduction in cases?
I wouldn't say so, because I mean, we had about just about 3.something million vaccines, and one of the issues that we've had is that of those we've given only just 1.13 million, of those doses. So I think it's too early to begin to attribute that to the vaccines. I think we can still say, number one, because we have younger populations. Okay, if you compare Nigeria to places like US, like India, where they have more serious or severe cases, Nigeria seems to have a younger population, and so it is quite mild in those populations. Okay, and that is why if you compare our cases, like I said, we have only 164,000 compared to US that had over 31.9 million. Okay, so I wouldn't want to say, I think it would be too quick to attribute it to vaccines, because the number is quite insignificant.
So give us an idea of your experience, especially with the jab and people receiving them. Would you say that there's no more hesitancy, skepticism towards COVID-19 vaccines?
Okay, so I would say that it is actually a mix. A mix in the sense that we have people who, for example, some health workers who still have their doubts, about the long-term effects of the vaccine, which I would say is normal. Okay, so a lot of people, for example, feel that if they take it, particularly the women, they may not be able to conceive. We still have some of those, even amongst the health workers. Okay, and then we have some who are willing to get the vaccines. They are not health workers, but they are willing to get the vaccines, but for one reason or the other, they can't access it. So yes, on one part, particularly among some health workers, even though a lot of people have gotten it, but the hesitancy still remains. But there is this gap of those who really want to access those vaccines, who really want to get them, but for one reason or the other, they can't get it. So I think it's a mix, kind of.
So thank you, Dr. Simon Okerinde, public health physician. Thank you for joining us on the program.
Yes, thank you for having me.
Now we go outside Nigeria to India, which appears to be recording its highest one-day tally of new COVID-19 cases and its highest number of deaths in 24 hours. It recorded nearly 315,000 cases in the last 24 hours. Oxygen supply has also been a problem, with the number of hospitals in the capital, New Delhi, running out entirely.
It has been a hard last few days in New Delhi, where, coupled with a rising number of COVID-19 cases, is a shortage of oxygen. People have been working to boost oxygen supplies. Hospitals across northern and western India, including the capital, have issued notices to say they have only a few hours of medical oxygen required to keep COVID-19 patients alive.
India has witnessed nearly 2 lakh new cases of COVID in the country in the last 24 hours, a very frightening number. And more frightening is the fact that this number is not yet the peak of our cases. The numbers are rising, and it's anybody's guess where this number is going to stop. There are all kinds of activities still happening across the country, which are likely to lead to further increase in these numbers in the coming few days.
Despite the shortage, coronavirus patients continue to flood hospitals. The country has recorded close to 16 million confirmed cases, second only to the United States. The country is in the grip of a second wave, raising more fears about its overwhelmed healthcare system. But unlike last year, when a national lockdown was announced, this time only regions are implementing their own rules. Delhi announced a week-long lockdown at the weekend, leaving just government offices and essential services like hospitals, pharmacies and grocers open. Authorities in the worst affected state of Maharashtra, which was already under partial lockdown, have announced a series of additional restrictions starting from this evening. Uttar Pradesh, which is also reporting a high caseload, has adopted a more conservative approach, with its High Court on Monday ordering a lockdown in 5 badly affected districts. However, it was put on hold after the government appealed against the decision in the Supreme Court. India, which has a population of more than 1 billion people, has so far administered more than 130 million doses of coronavirus vaccines. But the drive has been restricted to health workers, frontline staff, those above the age of 45, and anyone with comorbidities.
Still ahead, we find out how lockdown is easing in the United Kingdom. We have a guest joining us. Stay with us. Welcome back. Last week, non-essential retail and outdoor hospitality venues reopened in England, while people were allowed to visit with members of their household. For many, the reopening led to long-awaited reunions with friends and family or overdue haircuts. We talked to Dr. Etienne Ukorobi, GP Registrar, Worcester Royal Hospital in England. He joins us for more on the lockdown ease. Thanks for joining us on the program.
Thank you very much.
So tell us, how does it feel, the ease of COVID restrictions? Perhaps for you as a health worker, you kept going to work, but what does it look like now?
I must say it's a very good feeling to be finally out of lockdown. Having been in lockdown for more than 1 year now, to see the country going back to normal, it is an exciting feeling. So on the 12th of April, we saw a further step in the easing of the lockdown with non-essential shops opening. I was able to get a haircut after almost 1 year of not being able to go to the barbers. And we've seen shops open, and just beyond the fact that shops are open, beyond the fact that we can see our families and friends and sit out with them again, is the fact that we can see that, the number of people dying in the UK has fallen drastically. We've seen that the number of people in hospital has also reduced drastically, and that brings smiles, not just to the faces of the health workers, but to everyone at large.
So essentially less, pressure on you as a health worker. But talk to us about the fear, if there are any fears for children and perhaps young adults who aren't being vaccinated as yet.
Definitely, it's less pressure for us as health workers at the moment, because we, like I said, have seen quite a drop in the numbers. And for children, during the first and the second wave, studies had shown that it's less likely for children to have serious infection or serious illnesses from COVID-19. And we saw this play out in the first wave and the second wave of coronavirus. And there is no fear at the moment for children. We know that in the nearest future, we will see vaccinations being extended to children, and that would come after the most vulnerable persons. So the elderly people, the middle-aged population have all been vaccinated, and then we can then focus on the children. But at the moment, there has been no fear previously for children in terms of COVID-19 infection, and currently there's still no fear.
So scientists have also confirmed that the reduction of coronavirus cases and deaths are due to the vaccine rollout rather than the lockdowns, which, have been put in place or were put in place. What do you think about this? And plus it really becomes a concern for countries who don't have enough vaccines for their population, doesn't it?
Yeah, it clearly shows that the vaccine was the major deal in the fight against the coronavirus pandemic. We saw the pandemic start with lockdown in various countries, and that did not change anything. We still saw numbers surge across the world. And with the emergence of the vaccine, we've seen a drastic reduction in the numbers of deaths, in the numbers of hospitalization. In UK, this week, on Monday, we had 4 deaths. That's the lowest that we've seen in 7 months. And that can clearly be attributed to the success of the rollout of the vaccine. And with countries who are still struggling to get the vaccine, I would say that we cannot completely win the battle against this pandemic if one country alone is totally vaccinated. UK has vaccinated close to 50% of its population, but that's not the end of the battle. The battle will be completed when poorer countries who are not able to get this vaccine have this vaccine extended out to them by some of these countries who have more than enough vaccine. So I think it's a problem that some countries don't have it, but that signifies that we are still far from the end of the pandemic.
All right, we'd like to appreciate your time always on the program. Dr. Estienne Ukurabi, GP Registrar, Worcester Royal Hospital. Thank you for joining us.
Thank you very much.
Meanwhile, the European Union says it would not take up an option to buy 100 million additional doses of AstraZeneca COVID-19 vaccines, which is included in the current supply contract the EU has with the company. A spokesperson told a news conference that the deadline to exercise the option had already expired and the EU did not plan to take it up. Here's more on the global update.
The EU Commission has ordered 300 million doses from AstraZeneca as part of a contract that included 400 million doses, of which 100 million was optional. The EU says it is considering all options to ensure that AstraZeneca meets its commitment with the EU on delivery of COVID-19 vaccines.
We are looking at all the options which help us to ensure timely delivery of doses.
In the United States, the number of COVID cases has surpassed 31.86 million, while the death toll exceeded 569,000 people. According to the Center for Systems Science and Engineering at Johns Hopkins University, the country's cases had risen to 31,862,080 infections as the national death toll reaches 569,401 fatalities as of Wednesday.
There are countries that are frankly of greater risk than others.
Australia says it will reduce the number of citizens able to return from India and other red zone countries to contain the risk of more virulent strains of COVID-19. The changes affect direct flight from India to Sydney and chartered flight that land in the Northern Territory. Prime Minister Scott Morrison says he would announce in the next 24 hours when the new restrictions would come into place.
We'll be reducing by some 30% the numbers coming through our chartered services in the months ahead. We will also be limiting the departure exceptions for Australians travelling to high-risk countries, and that the one we're nominating at the moment, and there will be others, and we'll be working through that over the course of the next week.
Argentina is facing its worst moment of the COVID pandemic. The country's deaths from the virus neared 60,000 amid a sharp second wave that has forced the country to reimpose some lockdown measures. Argentina, which is rolling out an inoculation program likely around Russia's Sputnik V vaccine, has recorded over 2.7 million COVID-19 cases and has set a series of new daily records for infections in recent weeks.
Don't forget to protect yourself. Continue to take responsibility. You can visit our website for a better understanding of the pandemic and more updates. You find several other stories there as well. It's channelstv.com. That's the program this evening. Thank you for watching. I'm Millicent Nwaka. Stay healthy.